Welcome back, everyone. It is 9:16, and we have a health alert that parents should know about. A new study funded by the CDC is sounding the alarm about the impact that sepsis is having on children nationwide. More than 1,800 pediatric patients died from sepsis in 2022. It was only until recently that doctors were actually able to reliably track sepsis cases for children across the country. And joining me now is Dr. Benny Joyner, who is the chair of pediatrics at UB's Jacobs School of Medicine and the pediatrician-in-chief at Golisano Children's Hospital. Thanks for being here this morning.
Thank you, Melissa, for having me.
Yeah, to talk about this really important issue that parents need to know about. We just saw some of the symptoms posted, but again, explain to us what is sepsis for those who don't know, and what are the warning signs, first of all, that parents should be looking for?
Yeah, I think that's a great question, and I think it's such a complex question, and it goes to some of the reasons why this study was so important. It's really two parts. There's an infection that occurs in the body, and then the second part of it is the body's response to the infection. So we can find the infection, we can diagnose the infection pretty reliably, but the hard part is how does the body respond to that infection? And I think that's what becomes really challenging for us to understand.
Okay, and what is the biggest takeaway of this study about how many children have died from sepsis?
Yeah, so I think the biggest takeaway is that it's such a complex disease, and that we are getting better at detecting it through our ability to get information from the medical records. And I think all of us working together as children's hospitals, as systems, are really allowing us to better identify those symptoms that you just highlighted.
Yeah, what made it so hard to track before, and why is this just coming out now?
Yeah, because if you can imagine that we can, as I said, get the infection or get the bacteria, get the virus diagnosis, but the hard part is what are the other signs and symptoms? How do we objectively, or how do we independently say, okay, this is a high fever, and then collect all that information from everyone? And what we're able to do now is to collect that information through our electronic medical records.
Okay, and what about here in Buffalo? Are we seeing higher numbers than in other parts of the country, or lower perhaps?
Yeah, no, we're not seeing higher or lower numbers. It's been pretty stable over the past several years. The issue is that it's two parts, like I talked about. It's the infection and then the body's response to the infection. So while at sometimes we'll have increases in infections like RSV or other types of infections, that puts those children at risk for getting sepsis, and because it's the body's reaction to those infections that causes that.
How do doctors go about preventing it? I mean, with treating a child for RSV is bad enough, but then to make sure that it doesn't get to the point that sepsis is contracted.
Yeah, so I think that the biggest thing is vigilance. So being aware of it, recognizing the signs and symptoms, and really thinking about that. You know, we have a saying, I work in the intensive care unit, and we have a saying, especially for kids who come in sick, we really aren't sure what's going on. It's sepsis, 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 and then we think about other things. And so really being aware of the signs and symptoms, being vigilant that it could turn into sepsis, and then honestly for parents, it's prevention, like making sure their kids don't get sick, right? So getting vaccinated on time so that you don't get the respiratory illness that puts you in the hospital, that sets you up.
Yeah, and what about more preventative steps that parents can take? You just mentioned the vaccinations. What else should they do to protect their child?
I know, it's so hard because we don't want to walk around, chasing after them, but at the same time, I think it's important that you wash your hands with soap and water often. You know, if you have a big cut or scrape, to not simply ignore it, to watch it. If after a couple days you don't notice any healing, or you notice these red streak marks that don't look normal, or if it still is really, really painful, those are signs and symptoms that maybe I need to get this looked at by my doctor. And then again, I think the biggest thing that we've learned is to trust your gut. If your son or daughter, moms and dads know their kids the best, but if your son or daughter isn't quite acting right, is sleepier than normal, is really difficult to wake up maybe, but has those symptoms, those unexplained shakes and chills and high fevers, it's time to sort of call and get them evaluated.
Okay, and in case we missed the symptoms there, again, you said lethargy, and what are some of the other symptoms that parents should be looking for?
Really, really high fevers. But that in and of itself isn't a bad thing. As we jokingly say sometimes, fever is your friend. It's your body's signal that it's trying to fight off an infection. So that's the first thing, monitoring that. But also looking at how are they acting? Are they acting confused? Are they acting disoriented? Are they not acting like themselves? Are they sleepier than normal? And then because it's the body's response, all of the other organ signs, the heart rate is really, really fast. They're really breathing abnormally, maybe more shallow than normal or faster than normal. It looks like they're working. They're sweating profusely, for an unexplained reason. A lot of stomach upset. And then a big thing is that they can get dehydrated through this, so they're not going to the bathroom nearly as much as they used to.
Okay. And finally, with now having this information, how can it help doctors like you and those at Golisano Children's Hospital, protect children even more?
Yeah, I think one, it's critical to have this information because as we are able to look at the data within the electronic medical record, we're better refining our analysis or our diagnosis of sepsis. Here are the criteria. Here are those things that make sepsis more likely. Here's the criteria that make bad sepsis more likely. And when we start to see these things, we need to jump on it. So it allows us to, it arms ourselves with information to be able to act quickly.
Wonderful. Dr. Joyner, thanks so much for being here with us live this morning to share this really critical information for us. We appreciate it.
Appreciate the time.
All right, stay with us. We've got a lot more coming up right after the break here on Daybreak.